Hi, this is Dr. William Portuese in Seattle. Today we're talking about addressing the droopy tip with a closed rhinoplasty approach. The droopy tip is usually caused from a combination of factors such as downwardly pointing nasal tip cartilages or a downwardly pointing caudal septum or the hanging columella. It's also accentuated with an active depressor septi ligament, which pulls the tip down even more so when smiling. Now, when we do a rhinoplasty procedure, we can statically lift the tip of the nose by modifying the nasal tip cartilages, modifying the nasal septum or the columella, and then we also release that depressor septi ligament that tethers or pulls the tip downward when smiling. So patients not only get a static improvement in the droopy tip, but they also get a dynamic improvement because their tip doesn't droop when they smile. The surgery itself is performed through a closed rhinoplasty approach. All of the incisions are on the inside of the nose. Stitches are dissolvable. There's no painful packing placed on the inside of the nose. The procedure is performed under general anesthesia by a board-certified physician anesthesiologist in our Medicare-certified outpatient surgery center. The procedure itself usually takes approximately an hour and a half under that general anesthesia. The cast is applied across the bridge of the nose at the time of the surgery and is removed at about a week afterwards. Once we remove the cast, patients can see their new nose, and immediately they notice that their tip doesn't droop when they smile, and it is lifted up statically as well. We tell patients to anticipate about 2 weeks of visible bruising and swelling after the procedure, and then the healing process after a rhinoplasty, about 70% of the swelling is subsided at approximately 1 month, about 90% at 3 months, but full healing does take a year to take full effect. The patients tend to notice immediately after surgery, even within days after the surgery, that their nose doesn't droop anymore when they smile, even with their cast on.